abdominal wall tension and early outcomes after posterior component separation with TAR. Does a tension-free closure really matter? A tension-free repair during abdominal reconstruction is a surgical tenet, and tension is purportedly linked to negative outcomes like those listed below, but objective evidence linking these outcomes to abdominal tension is absent. This was a post-hoc analysis of a prospective case series of 100 patients enrolled at a single institution from January to July 2022. All patients underwent a TAR, and we performed abdominal tensiometry at baseline and then at closure. We captured outcomes in the Abdominal Core Health Quality Collaborative Registry per our practice standard. 30-day outcomes were assessed, including surgical site infections, surgical site occurrences, ileus, reoperations and readmissions, cardiac complications, thromboembolic events, bleeding requiring transfusion, and pulmonary and renal complications. Our aim was to evaluate the association between abdominal tension during a TAR and 30-day postoperative outcomes. 100 patients were included in the study. Median BMI was 32, and most of these hernias were recurrent. Median hernia width was 13 centimeters, and 98% of these patients had complete fascial closure. Mean baseline tension of the abdominal wall was almost 7 pounds, and this is from each side, not summed, and mean closure tension was just over 3 pounds. Here are 30-day outcomes. The most common complication was ileus, followed by wound events and hospital readmission, and then bleeding requiring transfusion. Complications like respiratory failure or kidney injury were relatively rare. We then did univariate regression modeling to evaluate the association between abdominal tension and the 30-day outcomes that were common enough to be evaluated, which included wound events, readmission, ileus, and bleeding. And we didn't find an association between any of these outcomes and tension, baseline tension, change in tension, or abdominal tension at hernia closure. Abdominal tension may not be associated with negative short-term outcomes after TAR, but more work is needed to determine if tension is associated with long-term outcomes, such as hernia recurrence.